So let's talk about what is coming our way, okay? And entitlements, Medicare, Medicaid, Social Security, to a different degree, are all in the mix. Yesterday, House Minority Leader Jeffries and Senator Booker held a sit-in on the Capitol steps saying they're going to cut Medicare and Medicaid. Let's ask the man who was just sworn in as the new administrator for the Centers of Medicare and Medicaid Services, Dr. Mehmet Oz. Congratulations, Doc. Good to see you.
Good to see you, Chris.
So the first question is, have you been told that Medicaid and Medicare services are going to be cut in this upcoming budget if the administration has its way?
No, the president has said to me repeatedly and publicly that he wants to love and cherish these vital programs. You know, when you walk in the office building that I work in at Humphreys, which is named after Hubert Humphrey, you see a quote from him. And I think it's worth remembering that quote because it applies to our great society. We must take care of our most vulnerable. That's how we're judged, by the way. And what Hubert Humphrey said was, it is the moral obligation of government to take care of those at the dawn of life, children, those in the twilight of their life, our seniors, and those in the shadows. Those are the most vulnerable. Those are the folks for whom Medicaid was originally designed. And what we have to do, and this is not about politics, this is about patriotism, but we must make these programs strong to do just that. And so if you look from my perspective out there, you see massive amounts of fraud, waste, and abuse. We have to enforce the rules to stop that. I can regale you with numbers, and maybe we will later in this interview. But we also have to empower the average American so they actually can control their destiny. And we have to provide incentives for the providers, the doctors, the hospitals to be more efficient with how they shepherd our dollars. And I want to caution everybody, when we get into this debate, it sort of goes around and around. But at its very core, 70% of what we spend on healthcare is driven by chronic illness. That's why the MAHA movement is so important. If we make America healthy again, then we'll be able to use those funds that we're saving by not spending it on chronic illness management when it's already a little bit late sometimes for preventive services that help all of us.
Well, if you can get preventive services covered, that'd be great. Right? A lot of people don't get it within their network. Their doctors, want to treat them, but they know they're not going to get paid. So that would actually expand. And then that's kind of your problem, is everybody's talking about cutting, maybe for tax cuts, because you got to cut spending at some point. You weren't part of the last administration, but he cut taxes, didn't cut spending, and ballooned the deficit. So conservatives don't want to let him do that again. You're going to have to deal with that. And you need an expansion, if anything, Doc, because you have all these red states that didn't expand when they had the chance, so they have disproportionate numbers of people in their states who aren't covered. What do you do about that?
We've got wonderful tools that weren't available even a few years ago that we could apply to make sure that we can ensure that everyone has access to what they need in order to live the best lives possible. But I want to take a step back from this polemic that we're getting into. At its very core, our responsibility to each other is to make sure that we're supportive of the most vulnerable. So to do that correctly, you have to be thoughtful and curious about what you want to do. Too often people leap at an idea thinking that's going to resonate for them. They can bark that out to their colleagues or on the Capitol steps or on pundits on media. But my job, my responsibility, and I'm blessed with a very strong group at CMS, brilliant folks working hard. They feel unleashed now. What this president has done in the first 100 days, it give us very clear directives. These executive orders are crisp, and they're designed to make sure that we know what he wants. And our job is to make sure that those tasks, which, again, the American people voted for President Trump, so they want what he wants done, our job is to make sure we act on those opportunities. And many of them are designed to help CMS, my agency, and under Bobby Kennedy, we're doing this very effectively, get out there and make sure that Americans are getting healthier. I'll give you one good example. I think we ought to have better interagency cooperation. If there's great wisdom at the NIH to research the causes of chronic illnesses, or frankly any illness, and the FDA is out there and has the ability to answer those questions with really thoughtful opportunities to help Americans stay healthier, the best technologies, for example, the best concepts, and then the CMS, what I am responsible for, can pay for these because we've been very careful in how we've shepherded the funds that are available. Remember, the funds we're spending come from the taxpayer. So our job is to abide the fiscal responsibility to make sure that we're thoughtful about how we invest those so we get the most return for that. We're already spending, Chris, twice as much per capita as any other country in the developed world. Twice as much. And yet our survival rate since you and I were in college has dropped to about 5 years behind Europe. We are witnessing the #3 cause of death being healthcare mistakes. So there's lots we can do better. instead of looking at the edges of this and trying to pick on each other, we need to focus on the patriotic responsibility that each of us have to be as healthy as possible. And I think that wisdom is being out there ensured by President Trump's actions and by Secretary Kennedy's wisdom to flow down to all of us in the agencies. And that's what we're laser focused on.
What are you going to do if, and you know, you can say it's a hypothetical, but it's not that far-fetched, Doc. If it turns out that, hey, look, we changed our mind. We have to make cuts to the biggest buckets because we need a tax cut to get out of this economic stress that we're in right now. Would you fight against that, even if it's the directive of the administration? What about your duty to the little man in that case?
President Trump's not going to do that. I'll tell you what he is going to do, because he told me to do this, is go out there and crush the waste and fraud and the abuse that exists in the system. Chris, I'm going to give you some numbers that are going to blow your mind, and I think the audience will be sort of pushed back a little bit by this. But I also want to emphasize that the main way we make these systems work for all Americans is to make sure that the federal government and the states are aligned. Right now, we have these paradoxical incentives where if you're a state, you may actually want to do stuff that's not in the best interest of the federal government or vice versa. So here's some numbers. Are you ready? $1 billion
Yes,
we spend on people who are on Medicaid in multiple states at the same time.
Multiple states.
Nobody wants that, but the individual states, they benefit from having the extra person on their rolls who's not getting care. We spent $200 million in the last term on CMS last year on housekeeping services, $10 million on public unions, child care services, another $10 million, by the way, on student loans. These aren't related to taking care of our most vulnerable. When Hubert Humphrey, a Democrat, said that we have a moral obligation to take care of those in the dawn, the twilight, and the shadows of life, he wasn't talking about student loans or DEI programs. Let's use the money that the American people have given us for the purpose that they're trusting us to use it for. That's what the president has told me over and over again. Trust and cherish Medicare and Medicaid. Don't let unscrupulous people steal money from our most vulnerable. And I promise you we're going to be aggressive in enforcing those rules.
But you have, like, you know, you have a split, right? It's overwhelmingly federal, but you have federal and state. You get somewhere upwards of over $850 billion. Waste, fraud, and abuse is going to be pennies. Look, you know, obviously you should find it, you should identify it, you should get rid of it. That's always been popular, okay? I've never heard of any administration not looking for waste, fraud, and abuse, and I've never heard of anybody not finding it. But it's pennies on the dollar in terms of what you're spending. And what if they want real cuts? You know, because those numbers, you could cut everything there. You're still, you know, nowhere in terms of the overall budget.
You know, Chris, before I took this position, I thought what you thought. It's not right. We probably have $100 billion of fraud, waste, and abuse. And it's, again, it's not just foreign elements, and there are out there, trying to defraud us by stealing money for our most vulnerable. And I say that again. There are other countries that are actively involved in this process, or at least citizens of other countries involved in the process. But what I'm also realizing is that when you misalign what states want from what the national groups like CMS want, you end up with people gaming the system. They'll actually charge more for Medicaid patients than people who are on commercial insurance. These are massive numbers, Chris. When states can play games with their budget and then the federal government reimburses them for those games, you have inequality. Some states, California and New York, are really good at it. Other states aren't so good at it. So you've got taxpayers, for example, in Mississippi and Alabama and Texas paying for illegal immigrants getting Medicaid support in California. That's not fair. Most Americans watching this program right now are going to look up and say, what are you talking about? How's that possible? Well, if one state allows certain things to be under their Medicaid program, because Medicaid's run by states, and then passes the bill to the federal government, guess whose taxpayers are paying that bill? Every other state's.
Everybody's, yeah. How overwhelming has this been for you, Mehmet? You know, you're a brilliant doctor in your own right, but you're not a bureaucrat. You've never been a policy guy. What's the learning curve like for you?
Oh, it's steep. The learning curve, it's like drinking from a fire hose. But I actually think this is the best job I've ever had. Surrounded by brilliant people, hardworking individuals, folks like Stephanie Carlson, who was the acting administrator until I was confirmed by the Senate, did a spectacular job pulling the agency together. I'm over, again, each day surprised by the great ideas that come from within the middle of the organization. Remember, we've got 6,000, a little more folks that are within the government at CMS, but we have 40,000 contractors on the outside. There's lots of talent there. My main job is to make sure smart people don't kill each other, and also to make sure that the best ideas percolate from within the organization and come and rise to the top. And we have a generational opportunity, Chris, because there are people coming from the outside, giving up all their private sector wealth and ambition and opportunity because as patriots, they want to serve within the government. And some of these folks, like Chris Klump, for example, just joined us this week. He gave up a fantastic opportunity that he was on the outside profiting from. He gave it up because he really understands the challenges. He came in. I think that's wonderful. And that's two of many examples that are out there. Folks like John Brooks and Kim Branch, just superstars who are doing everything possible to make sure that the organizations like CMS are serving their people. But I got to hand it to two people in particular. Bobby Kennedy has done a spectacular job pulling together all the different agencies. It's like a band of brothers. You've got Jay Bhattacharya, Wani McCary at the FDA, Jay's at NIH, collaborating. And we have the president at the top, who is the best leader I've ever worked with. And again, I'm speaking from someone who's on the inside. When he is focused on the topic that you're engaged in, he knows exactly, instinctively, what opportunities may lie there. And he trusts us to enforce what he thinks needs to be done. And that's why you have so many loyal people within the administration.
I'll take your word for it. We'll see what the results are. Mehmet, I look forward to seeing what you do, Doc, during the budget process when they start having to come out and disclose where they want budget cuts to come from if they want tax breaks. And you'll always have a platform here to make the case to the American people for what is wanted and what you think is right and not right for the people you're serving.
God bless you, Chris.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.